This is a video for eyebrow wax and lip wax. So before you even begin, you are going to prepare your station and work area for your client. And to do that, you have to disinfect your workstation, your bed, and equipment using a disinfectant wipe following manufacturer's instructions. You're going to check the equipment to ensure that all of the devices are in safe working order and plugged into a working receptacle. You're going to gather clean supplies needed for the facial waxing service, storing in a clean, closed container. You will dispense products needed for the service. So you're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray. Or you can remove the product with a disinfected or clean single-use spatula and then close the lid to the product and set the portion cup or tray on the tray. You'll place disposable table paper on the disinfectant bed to ensure that the wax does not fall onto the bed. And then you can greet your client and your client will arrive. So what's going to happen now is that you're going to greet your client with already cleansed hands. We are going to do this again in a minute, but just so you know, when you start that process, your hands are already clean. So you're going to greet your client and escort them to the work area. You will assess the client's current style. You will determine the client's preferences, assess the client's needs. You will assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation such as lice to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours. You will consult on any known allergies. You will consult with a client on any facial surgeries within the last 3 months, and if the client is under a physician's care, you will assess if the client is prone to cold sores or fever blisters. You will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above, you can move forward with the service. So the first thing that we're going to do, because our client is okay, is we're going to get her situated. So we're going to take her into the room and we will set her up. So she is laying down comfortably on the bed, and what we need to do now is she's in a little drape. We're going to get her headband on, keep her hair out of the way of any wax. Put this over her ears, I think. And then we have a rolled towel that we're going to place under her neck for comfort. And then I've got another towel here. I'm going to drape her up so that no wax would get on her clothes or her body anywhere. And then I also have my tray of everything already prepared with my single-use spatulas, all of my disposable cups. I've got my waxing strips, cotton rounds, extra sticks if I need them, disposable gloves. I've got my tweezers and scissors. I've got little paper towels, and I've got a mirror to show the client at the end. So we are going to get started, and it's at this point that you would wash your hands. So what's going to happen right now is you would go to the sink and you would turn the water on and you would wet your hands. And you would then get liquid hand soap out, and you would rub your palms together with the liquid hand soap. You would wash the backs of your hands as well down to the wrists. You would interlace the fingers and wash between the fingers. And then you would wash between the thumb and the fingers. You'd wash those fingers, of course, the backs of your fingers. You would wash your nails and your fingertips. You would wash your thumbs. You're going to be doing this interlocking motion under the water for a minimum of 20 to 30 seconds washing. You're going to wash your wrists. And once you've done all of that, you can do your rinse. And you take your time, do your proper rinse under the water. And then you're going to reach for disposable paper towels. When you grab those paper towels, that hand with the paper towel is going to turn off the water faucet, and then you're going to completely dry off your hands. Once your hands are completely dried properly, throw away your paper towels and grab your hand sanitizer and sanitize your hands. Now, you're going to want to make sure you go through all the steps with your hand sanitizer as well, but one of the most important things that you can think about is that your hands get completely dry, because you now have to put on disposable gloves. So give it a second to let your hands dry. And I've done this like 1,000 times today, so my hands are not getting dry very easily. And then you're going to put on your disposable gloves. It's not really 1,000, but it feels like it. Five hours of it. It feels like 1,000 times. And once you have your gloves on, you can go to your client, and we'll start at the brow, and we will analyze the direction of the hair growth and how much is there and how much we want to take away, all that stuff. So that's the first thing that I'm going to do is I'm going to look at her eyebrows. I'm going to see how much I've kind of, we've looked at the shape and talked about it and stuff ahead of time, but really just seeing how the hair grows and where we're going to take away. And then once we kind of figure out our game plan, we will thoroughly cleanse and remove any makeup, etc. up here. So that's the first thing we're going to do is we're going to cleanse the eyebrow area. Astringent. And you definitely want to do a really good cleanse. You don't want any concealer or moisturizer, or eye cream, makeup, anything like that to be on the skin or the brow. It will affect the waxing. And you certainly don't want them to go to all this trouble and have a situation, so. Take their time to get it clean. And once you feel like you've really done that and it's really clean, you're gonna wanna make sure it gets super duper dry. You can even powder if you need to. And when you feel like everything's dry and you're ready to go in with the wax, you will not, because you're going to check it on yourself first. You got to make sure that temperature is good. So you're going to take one of your single-use spatulas. You're going to get a little bit of the wax, and you're going to test it on the inside of your forearm. And it feels great to me. So I am going to remove it. If it feels good on me, then I know it's okay for the client. So we can officially, comfortably get started performing the waxing. and I'm applying the wax in the direction that the hair grows, I will remove it in the opposite direction that the hair grows. I'm going to hold the skin nice and tight and then press. Everything looks really nice. So what we want to do now is remove any residue that might be there from the wax. And then you're going to get your tweezers and follow through with any cleanup that you might need to do that way. And when you tweeze, you will actually pull out the hair in the direction of the hair growth. Which this might be allow you to do some detail work too with your shaping and just make everything really, really nice. And then you are ready to go to the other brow. remove that residue of any wax. And then we're going to grab our tweezers and we're going to work a little bit on that. See how we're doing. Good. So we are going to go between the brow and the hair here goes down. So we're going down the wax. Nice tight. And we're gonna get our residue gone. And we're going to get our tweezers. But her brows are looking gorgeous. And all we need to do now is quick double check, but everything looks really good, so it's time for our soothing gel. Calm everything down, make everything feel amazing. And just basically means that you're getting close and you're ready to move on down to the lip. So you would literally follow every single solitary step for the lip that you just did for the brow, with one exception. Because it's the same client, you do not have to test the temperature of the wax again, except if that was the only service, then of course you would, because you would be doing that in the process of skin analysis and etc. So what we're going to do is the same thing. We start with that hair growth analysis, like the direction of the hair, which way it grows, down, out, down, and how much we need to take away, etc. And once we figure that out, then we can move forward. So the only thing that we don't have to do for here is double check the temperature, because we've done that when we were up there. So no, I know which way the hair grows. I can see how much needs to be taken off. And what we're going to do is we have to start with step one, which is that cleanser, that astringent, like getting all the makeup, all the moisturizers or oils, sweat, everything off. So we really want to clean the area really nicely, so that nobody has to do this area again for a while. So you gotta take a minute, get it really clean. once you feel like you've gotten it really clean, then you need to get it really, really dry. And if you need powder, use it. Like everything is tip-top and spit-spot perfectly dry, then you can start the waxing because you don't have to check the temperature. You know the temperature already is good. Nice and tight with the skin. Of course, going in the direction of the hair growth with the wax application, away from the hair growth with the removal. Nice and tight. Last spot to get here is right in the middle. And then we need to remove residue anywhere and everywhere that it might be. And then I'm going to get in with my tools here and finish. with the Soothe. And once you feel like you've done your double check, you've soothed, everything looks stunningly gorgeous, you're going to grab your mirror and you can show your client, look at how great that is, the brows, the lip. They'll be oohing and awing. They'll be coming back in to book appointments yet left and right. And it's at this point that you can discard and throw away your gloves, and then you're going to talk to your client about maintenance and aftercare, and you'll get them checked out. Maybe they need to book a certain every so many weeks, etc., to come back. So you're done with your client and all of the linens that you used, etc. So let's talk about breakdown, because you have to go back to your client. You're going to be tossing away all your disposable cups and single-use items. No question about it. You are going to place your implements in a closed container marked to be disinfected. You will place all of the linens, the drape, etc., in a closed container until laundered. You need to then address your work area. So you need to identify proper cleaning agent and read manufacturer's directions. You will follow those manufacturer's directions for mixing and usage. You will wipe your workstation and area with a cleaning solution to remove debris. You will identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in salon setting. You will follow the manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You will disinfect electrical equipment and store that in clean areas separate from other implements. Once you've done all of that, and remember you had gloves on, different gloves on for doing your cleanup with the disinfectant, you toss those gloves and it's time to wash your hands one final time. So you wet your hands, you get your liquid hand soap, you turn the water on, wet your hands, get your liquid hand soap, and then you start to rub those palms together. You're going to wash them to the wrist. You're going to wash the back of your hands down to your wrist. You're going to wash between your fingers and your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your fingers completely, the backs of your fingers, your nails, and your fingertips you're going to wash. You're going to wash your thumbs. You're going to do this interlacing motion between your fingers 20 to 30 seconds underneath the running water. You're going to wash your wrists. When all that's said and done, you're going to thoroughly rinse your hands underneath the water. Then you're going to grab some paper towels and you're going to turn the water off with the hand with the paper towels. Completely dry your hands off. And then once those hands are dry, you can throw your paper towels away. Find your hand sanitizer. Get that hand sanitizer and go to town. You're going to do all the things that you just did with your cleansing process with the hand sanitizer. And when you finish that and your hands are completely dry, you can then move to your next client or service, or if it's your time to leave, you'll be ready to go home. And that concludes your video for eyebrow wax and lip wax.